Hello, Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Now today we're going to talk about issues in relation to the liver transplants and liver cancer. And, you know, it's such an important organ. And what we're going to talk about today is why does this get, ignored? Maybe because the symptoms are silent, maybe because we need more awareness. And for that, we have with us in our studios today, Dr. Najmul Hassan Shah, Founder, Director, Program, Liver Transplant. Thank you very much for joining us here today.
Thank you.
And also Dr. Ehsan Masood Gyani, who's an interventional radiologist. Thank you.
Thank you.
Dr. Najm, tell us, how much of a disease burden do we have in Pakistan regarding issues of the liver?
I think when it comes to liver disease, the bulk of the burden comes from viral hepatitis.
Mm-hmm.
So hepatitis B and C makes the most important component. And if I can give you some figures, like about 5% of the population has antibody positivity for hepatitis C. And the PMRC study suggests that 2.5% additional people might have hepatitis B. So you imagine like 200 million people, 7.5% have viral hepatitis, chronic viral hepatitis in Pakistan. Now you add additional diseases like liver diseases in children, there are autoimmune hepatitis, fatty liver disease, NASH. So I think you're talking about 10% of the population having chronic liver disease in one form or the other. So it's a huge
That
number.
is a huge burden and huge figure. So, because can there be people who are suffering and not knowing about it because the symptoms are not showing up?
I think this is very important because viral hepatitis, for example, hepatitis C is a very silent disease. Very small percentage of people actually manifest the acute symptoms, and most might have been exposed to it without ever knowing. And I think one of the reasons that we could not eliminate this virus from Pakistan so far is because many people are unaware of the disease. And therefore, most of the prevention and the treatment strategies now involve mass-scale screening so that you identify these patients. There used to be the question whether to see or not to see. The reason for that was hepatitis C. So I said to see or not to see.
Okay.
The reason for that was because there was not effective medicine available to cure the disease. But now with the changing availability of the new powerful drugs that can cure the disease, now the WHO has done like a 2030 millennium goals. One of the goals is to eliminate hepatitis from the world, and hepatitis C is on the top of that.
Right.
And the reason for that is they're powerful oral medicine, they're very well tolerated, and they're very effective. And therefore the whole communities like in Taiwan or China and the Korea, they've geared up to try and find out and do mass-scale screening and identify people who have hepatitis C and then eliminate the virus by giving them the antiviral therapy.
Right.
And this is the best way to eliminate the virus, because when you offer treatment for hepatitis C, you actually make them non-infectious and they can't transmit it to other people.
Right.
So now the strategy is changing. Previously, the whole thing was towards prevention, people who have, because this virus and hepatitis B mostly spreads through injection use and parenteral routes.
Okay.
So now safe blood transfusion, safe healthcare practices. So mostly the preventive strategy was the main way to prevent this further spreading.
Right.
But now everything is shifting. Now they say, find out who has the disease, and if they have active disease, offer them treatment, because that is the only way you can reduce the burden or the reservoir of the disease.
Right. Okay.
So I think that's
right. Yes, absolutely.
And similarly, there are many diseases in children and adults that they can only manifest when you do health screening, and therefore like autoimmune diseases or NASH, for example, fatty liver, these and some metabolic diseases that runs in over a long period of time before they manifest themselves with chronic liver disease and its manifestations. So therefore, health screening is very important, like routine blood tests,
Right.
to unmask and find out if somebody might be harboring
Right.
a chronic liver disease that might manifest later on, really.
Right,
Yeah.
exactly. Okay, Dr. Ihsan, tell us, why is there, if we talk about other organs or other parts of the body that a person, a non-technical, non-medical person, will sort of they're sure to take care of their heart, of their brain, their kidneys. Why does the liver come down at such a priority? Why aren't people more concerned, and how do we raise that concern?
Firstly, I would like to differ from that I don't think that we do care of any of our organs.
Oh.
Usually. We only start taking care of them when they stop
that's
working.
True. That's true.
And the heart is one organ whenever there is a problem, it's an acute problem and you just have to go to the doctor and you have to get that fixed. It's essential for life.
Right.
And the liver, as already been alluded to, is the diseases of the liver take a long time to manifest. The symptoms come very late. And that's probably one of the reasons why it is not highlighted that much. The same is with the lungs, as we also, when people smoke, they don't care about the lungs that much. And
it's only when they can't breathe, or
Exactly.
that's when they'll run to the doctor.
And similar, the heart and the brain are the same, because whenever you get a disease of the brain, you get a stroke. That's when people go to the hospital and get that fixed. And it's an acute problem. With liver, it is not that. It takes a long time to manifest, and the symptoms grow slowly over time.
So we're saying that, yes, okay, the symptoms are not as such that they manifest immediately. So what can a person actually do to make sure, Dr. Nijam has told us about screening, this is something that a person should be assertive in themselves. How often should they go to be screened, and who needs to be screened? Are there more high-risk people?
I think Dr. Najam would be a better person to answer that.
Yeah, I think there are two. One is there are liver diseases that will manifest itself as an acute setup, like people have nausea, vomiting, or easy fatigability, or weight loss, for example, or yellow discoloration of the sclera. So some people might observe them, or some people might have these symptoms. So whenever people feel such symptoms, they should go and be screened. That is for the acute onset.
And how often is the screening take place? Yearly? What
I think if you have a normal liver function test,
a normal liver
once,
function test.
Yeah, I think that would be.
That would give you a sort of an indication of if your liver is working okay.
Yeah.
All right.
And maybe an ultrasound scan of the liver. So that should be enough, like a minimum that would be required. But if you have all these vague symptoms and you're not sure what is going on, then I think maybe it's better to go and see a specialist, be examined, and have some basic screening test about the liver. And it takes only like one blood test or a couple of blood tests to find out if there is anything going on in the liver.
It's pretty easy.
Yeah.
It's not something that it's very hard for somebody to do. Okay, now when does a patient reach the stage that they need a liver transplant? Are we sort of jumping the gun here? Are the things coming in before, or what exactly happens?
I think here we are talking about chronic liver diseases. So if I take example of hepatitis C or hepatitis B, and if we have to look at the natural history, say people acquire it on a point in time, and then for 6 months it stays in your body, then we call it like chronic. So chronicity is defined by like 6 months of having that virus in the body. So if it stays inside the body, then it goes through and affects the liver, and the liver goes through different stages. So for example, if somebody has an acute viral hepatitis, they will have yellow discoloration, they will have symptoms, and then they recover from that. Once they become chronic, like if the virus remains in the liver for more than 6 months or the body, then we call this as chronic viral hepatitis. So this chronic viral hepatitis will manifest itself with symptoms like fatigability, anorexia, or...
So fatigue and weight loss is something that is associated with that.
And then if you do some blood tests, it would show inflammation of the liver. So these will be the signs, and if you test for the virus, then you can see the serology in the blood to see what sort of a stage of that virus is. when this, if you take 100 people, about 20 of them will clear the virus.
Okay.
80 of them will be chronic. So out of these chronic 80 people, if you follow them for 10 years, for example, majority of them will remain stable. But about 20 to 30% will develop a condition called cirrhosis.
Okay.
Because with
And what does that mean for the viewers who are?
I think with simply that means that the liver is injured by the virus due to the inflammation and damage, and then the liver has the capacity to regenerate itself. But the regeneration doesn't regenerate the liver in its original form, and therefore some scar tissue is formed. So every time there is injury and healing, that tussle between the body and the virus ultimately leads to like a scarred liver.
Okay.
And therefore the blood flow and the architecture of the liver changes, and we call that a cirrhotic liver, a scarred liver.
Okay.
And then many of the people who develop cirrhosis, they still might have a very good quality of life, and they might survive their whole life without any ever been manifested or seen by a doctor. But about four of them out of that 100 initial, they will decompensate. And then they will have free fluid in the tummy, they will have ascites, they might present with cancer of the liver, for example, or they might die of the disease, or they might throw up blood, for example.
Okay.
So all these manifestations called end-stage liver disease, like a decompensated disease.
Right.
So going through like the natural history, take 100, say 80 of them become chronic, then about 30% will develop cirrhosis, and then 4 of them will die of the disease. So imagine out of the 200 million Pakistanis, if 5% of them have hepatitis C, then you transform that, it appears like 1 in 4, like out of 4 out of 100 would develop this end stage. But when you look at you transform the burden to 200 million, 4 means a lot in Pakistan.
Absolutely.
So millions of people are dying from end-stage liver disease because it is so prevalent here.
Absolutely.
And you add like hepatitis B, 2.5% to it with the same natural history almost. And then there are so many other childhood diseases and metabolic diseases
that are all adding
NASH.
up.
So they're all adding up.
Right, okay. Dr. Ihsan, tell us, as an interventional radiologist, a patient who is going to be diagnosed with liver cancer, there's a suspicion and is tested as positive. What are the options of treatment available for them?
Okay, there are a lot of treatments now available for treatment of liver cancer, provided it is picked up earlier. The earlier it's picked up.
Is there any way of knowing?
Yes.
Is it? Yeah. Okay.
All hepatitis C or B patients, I think they should get themselves screened for liver cancer.
Okay.
Once every 6 months.
All right.
They should have an ultrasound done from a good place, as well as a simple blood test.
Okay.
And if it's positive, they should go on to further investigate with a CT scan or other modalities, so you can diagnose liver cancer at an early stage. Because the earlier you find the liver cancer, it is curable at early stages. So unfortunately in Pakistan, this is not well followed, this screening process. Not many people know about that. Not many consultants and doctors get their patients screened. So if we do that on a large scale basis, I think we can diagnose liver cancer at an earlier stage, and the treatments for liver cancer available in order of from best to worse. I'll just give them to you, summarize them for you. The best treatment obviously is liver transplant.
Right.
Because that would take the cancer out as well as the diseased or scarred liver, as Dr. Najm just told us. That is possible in very limited number of patients,
Right.
because above a certain, when the cancer becomes large enough, transplant is not an option for the patient. And the thing with liver cancer is, the liver is a large organ, and the cancer does not manifest, does not cause any symptoms. Usually it is asymptomatic until the cancer becomes so large that it starts pushing the liver surface. And that's when it usually is untreatable. So screening is extremely important.
How many patients come in that stage? I mean,
Unfortunately, we see quite a lot of patients. The patients who present to my clinic, I would say around 40% patients.
That's a huge number.
40 to 50 even, they come to me and I have to tell them that I'm sorry, we can't do anything about your patient. So on the other hand, the other 50%, 1 in 10 would be liable to get cured of this cancer. So liver transplant, we can put in needles into the liver cancer and burn it out. We inject alcohol directly into the cancer, and these treatments and surgery, if there's a small tumor in one half of the liver, the surgeon can go in and take out that whole portion, and that's a cure as well.
Okay.
So these are curative treatments available right now in Pakistan, and anywhere else in the world it's the same. Once the patient goes out of this category, what we do is we try to control the cancer.
Okay.
With various methods. We try to reduce its size, and the aim is to improve the life of the patient and increase the length of life expectancy, so the patient lives longer. And that translates into anywhere from a few months to a few years, depending on the size of the tumor, the number of tumors.
And the general health of the patient.
And the general health of the patient, exactly. So in that treatment, that's called TACE. In simple words, what we do is we block the artery that is supplying the liver cancer.
Okay.
In the same way, the cardiologists go into the heart and open up blocked arteries. What we do, we go into the arteries of the liver, and the arteries which are supplying the cancer, the tumor, we block them with certain different materials and with different drugs, and that helps to reduce the blood supply, and the cancer shrinks in size. And we have to do this every 2-3 months, repeat this cycle, so we have it in control.
Okay.
So that is one treatment, and unfortunately patients who cannot undergo this treatment would then go on they'll be offered a drug, a simple pill, which is less effective than all these treatments.
Right.
And if we can't even give the drug, then it's just simple symptomatic pain treatment and other
pain
treatment.
relief. Okay, Dr. Najam, tell us, a patient comes and they're a candidate for liver transplant. What goes on next? How are they evaluated?
The liver transplant is a complex procedure, and more than 100 people are involved, 360-degree, to offer that treatment.
Okay.
And a lot of skills are required. So that's why not many people can offer that.
Right.
But if I can say, the transplant process starts from pre-transplant surgery evaluation and assessments. So suppose the first question is liver transplant required now? Because not everyone will benefit from it. So if somebody has got stable cirrhosis and you transplant them early, that's not very good either.
That's counterproductive, is it?
Yeah, counterproductive, because after transplant there is a lot of, the transplant surgery itself is a big procedure, there's a big mortality of this, and therefore fitness of the patient is very important.
Okay.
We prefer the patient's diseased liver to keep them alive for as long as they can, till we reach to a stage. So there are definitive criteria to say when would you offer transplant to someone. So the process involved first to say, has that person reached to that stage? So there are set rules for that. Not like if a son wants to transplant and I don't. These are not, doesn't work like that.
Okay.
These are like international recognized indication for transplantation.
Right.
So when the patient comes to me, the first thing I see, can this liver sustain their life, or have they reached to that stage where a transplant is mandatory? Now once I make that decision to say, yes, I think this patient requires a transplant, then the next step is, they require a transplant, but can they sustain this operation? Because it's a big operation. Therefore, all the evaluation, like their heart and their kidneys and even psychiatric assessments and all blood tests, there's a lot of exercise involved, a multidisciplinary team then look at them to say, can they survive this operation?
Okay.
So once that process finishes, at the end of that we say, yes, this man or this person needs a transplant, and he can have a good chance of coming out of it alive after the surgery.
Afterwards,
So the third question is, where will it happen, or when will it happen? And then how much is going to cost? And then once it happens, and the patient comes out, the real challenge is to keep that graft going for as long as we can. And the patient then goes into the regular follow-up to receive some medication to keep that graft from rejection. And therefore, that period is even more important because somebody has donated to him, he has received this big operation, the graft is functioning now, and therefore we need to keep that graft going for as long as possible because that was the whole idea of giving him the new liver. So that becomes, the post-transplant care even becomes more important.
Right.
So that pre and peri and post-transplant care as a whole, I think these are the three areas.
So tell us about your contribution to the first and successful liver transplant that was carried out in Shifa Hospital.
I think I only, I can say that I came back from UK in 2009. I went to see the management of Shifa to set up a liver transplant program.
Okay.
At that time, before that, I think about 10 people, different institutions have attempted. But the first transplant in Pakistan happened actually in 2003 at Sindh Institute of Urology and Transplantation, way back in 2003.
Okay.
And then the other few attempts in Lahore and even PIMS here in Islamabad attempted. But somehow it was...
was it the whole network that was not functioning together?
I mean, I looked at why people are unable to like develop a liver transplant program. And then on the basis of that research, I did a feasibility study and offered to Shifa to say we would try to set up a program. Because I thought that most of the components for transplant program were available in that hospital. And if we could develop a team, then we probably will be able to set up a program. And luckily, and they said, we said we'll do the first transplant within 3 years. And the most important person in the transplant is the transplant surgeon.
Okay.
And one of my friend who was working at King's at that time, Dr. Faisal Saud Dar, I went to see him in King's and persuaded him. He wanted to come back to Pakistan.
Okay.
And I persuaded him to join Shifa with us to make a team. And we did our first transplant on 30th April 2012.
Okay.
Within well short of the 3 years period. And I can proudly say that that is a only sustained and successful transplant program in Pakistan.
Okay.
And the team has done about 600 transplant now.
Amazing.
So this is a major center now.
Right.
And I relocated from Shifa in 2017, this January, to try and set up another program.
Okay.
And we are almost ready now.
But that's running in its own capacity,
That's
the one
correct,
in Shifa.
yeah.
Okay.
So this is a Quaid-e-Azam International Hospital, is another tertiary care hospital. And I think that that hospital is probably has got the best infrastructure in Pakistan to support a transplant program.
Okay.
Because in Shifa, we were competing with other services while setting up because, and still managed to do it.
Right.
In this new hospital, there is more opportunity to set up a bigger program maybe and a better program. And this time what I've done different is that I have invited 6 transplant centers to help us internationally. So I've traveled to Turkey, China, India, UK, and Korea, and invited all the world top surgeons to Quaid-e-Azam International Hospital.
Right.
They visited us there. They inspected what infrastructure we have laid down. And we are now ready to give a breaking news and do our first transplant, hopefully either this month or next month.
Great,
And
fantastic.
this is different than Shifa in the way that this time we want to bring, to raise the bar in transplantation.
Okay.
And bring the international teams with us to try and train other surgeons on site rather than people going and being trained in the overseas centers.
Right.
So this is
You're
different.
bringing all that talent here.
Exactly,
It's a very,
exactly.
it's a very good strategy, that. Okay, so we're going to get back to the program, but right now we're going for a break. Do not change the channel. Welcome back to the programme. Dr. Ihsan, tell us, we were talking about cancer of the liver, and you were talking about the various options that are available, and we'll talk to Dr. Najm as well for other techniques that are available. Tell us about interventional radiologists. Are there enough in the country? Do we need more people to branch into this field? Tell us about this.
There are very few interventional radiologists in the country. We have a total of not more than 50 interventional radiologists in Pakistan right now, in the whole of the country,
right.
yes. And most of them are centered north of Lahore and in Karachi.
Okay.
So north of Lahore, we are very few here, say less than 10.
Okay.
And there are very few centers which are offering treatments in interventional radiology.
Okay.
Because the equipment is pretty expensive, the manpower is not available. So this is an upcoming field. That being said, in the last few years, the number is increasing.
Okay.
We have local trainees, new people being trained locally in Shifa, in Aga Khan, in Shaukat Khanam, and other hospitals in Karachi. And it's good to see people, Pakistanis from outside the country, who are coming back in Pakistan and offering
Their
services here.
Right.
So that being said, we are very few here, and there needs to be more done in this field. There are no interventional radiologists in Pindi, Islamabad and Peshawar in the government sector, and these services are not being offered at the present in the government sector, and that's a huge problem because it is an expensive treatment usually to have, and essential yet expensive, and people usually are not affording, they can't afford that much, the poor people, and so there needs to be a lot of work done in by the government as well, and by the societies in Pakistan who are working to improve the situation in this field. Yeah.
Right. So when does an interventional radiologist come into action? When are they needed? What sort of problems are addressed?
In relation to liver transplant?
Yes.
Okay,
or generally as well?
Generally, it's going to be a huge topic, but in relation to liver transplant, we come in for patients who are being treated, who have liver cancer and are being shortlisted for transplant. Because once you're shortlisted, to arrange the finances, the donors, and other stuff, you probably need. Some people need a lot of time. So the procedures that we do, it helps to buy time for the patients as well.
Okay.
So they can have the procedure done, and you can wait till all the other things are done. And in transplant, in post-transplant, the complications. The few patients that undergo complications, we as interventional radiologists are there to help out in a few complications like leaks, in abscesses, like infections. We can help out in draining the strictures. Yeah. So that's where we come in relation to liver transplant, and we're a big part of the multidisciplinary team which decides on which patient will benefit from transplant or any other, the other treatments available, and that's the major part as well.
Right, okay. And while we're on this subject, Dr. Najm, you're telling us about some, other techniques available, some breaking.
I think just to expand on what Dr. Ihsan was telling, cancer of the liver is very not uncommon in Pakistan. And the key for there's a lot of new treatments coming up in cancer of the liver. The key for management of patient with cancer, a multidisciplinary approach. Therefore, most of the people who are diagnosed with cancer of the liver needs to reach to a hospital where there is like a lot of people sitting together and discussing their case to decide how best to treat them. Individual treatments are no longer recommended. Individual physicians can't be dealing with hepatocellular cancer. So that is the key.
Right.
The reason for that is, out of all the treatment options available, we need to choose the one that can cure the patient. And if we miss that chance...
And again, as you said, it's an individual thing for every different patient. Will require a different management.
Exactly. So what we do is all the liver transplant surgeons, hepatologists, pathologists, oncologists, intervention radiologists sit across the table,
Okay.
and then we debate every week. That's how we work. And we bring in one person present to say, what would you do with this patient? And then everybody together makes a decision how best to treat that patient, and then hands that patient over to that specialty. And that's is the best way to maximize like the cure for these patients. So what we do in a multidisciplinary team is to decide whether we can cure this. That is the top idea. We need to select patient who can be cured of disease. So cure means like liver transplantation.
Right.
Or
Are donors easy to find?
I think usually we have a living donor transplant program. There are two types of liver transplant. One is a
Okay.
cadaveric transplant, and one is a living donor transplant. In Pakistan, most of the relatives are only allowed to donate, and therefore we take like a piece of liver from one of the compatible donor within the family, and we implant it into the patient and take out the diseased liver from the patient. And then God has given this a great regenerative capacity to the liver, so that piece grows to like and functions like a normal liver, and the piece left to the donor also then grows. And this technique of living donor has come because of this like quality of the liver.
Okay,
that
the
can
regeneration.
regenerate.
Okay.
And Pakistan, the family size is big, and we don't take any unrelated donors.
Okay.
And Human Organ Transplant Authority is the one that regulates the legal transplantation.
Which is very important.
Exactly. And then once we decide which donor, and for the liver donation, this is not like kidney. Is the ABO compatibility.
Okay.
Like say the blood group compatibility is important,
I
and the size of
see.
the liver.
Okay.
And the most important thing is if we take out the liver piece to give it to the recipient, whether the remaining liver is enough for the first 3-4 weeks when it regenerates to not put any that the donor at any risk. So that is done with a lot of computer analysis, where to cut and how much to give to the recipient and donor.
Okay.
So that's a very complex
Right.
procedure. But I think donors, as you asked, mostly related donor within the family,
okay.
or maybe not necessarily sons and daughters. I mean, we have rules where other family members can donate
be
as
also
well.
be
Yeah.
considered. Okay. Dr. Santos, how can we sort of, make Pakistan more of have a donor mindset? How can we go across doing that? Because you do find a lot of controversy here and people not understanding, what's going on. So.
I think for that you need to improve the knowledge level of the general population. Our consultants, all consultants need to be talking to the patients who might be transplant candidates and to their families as well. And because not all patients would end up initially in the liver transplant program.
Right.
So all physicians in the periphery, they need to be educated. They need to be told what is involved in it, and they need to translate that to their patients and their families. And the government also, I think they and the other societies of our profession, they also need to have a mass, information system awareness program, which will help patients and the general population to be aware of what's involved. And programs like yours, they help out in telling patients and their attendants to relieve the anxieties involved.
Yeah.
And what I tell my patients is, even if they tell me that they are not going to have a transplant done, I tell them that that's not an issue. You keep your decision, but I prefer that you go and meet a transplant surgeon or a hepatologist who is working and let them try to tell you what it is, and then you make an informed decision.
That's true. The informed decision.
Informed decision is very important because
a lot of things in our society rely on hearsay. And somebody will tell you something that they heard from somebody else, and then you have all these myths that are going crazy. And
like, I'm not an expert in that, and Dr. Najam is. It's better that I send the patient to Dr. Najam and he tries to explain, because I'm not going to explain the right stuff to him.
Dr. Najam, do consultants have enough time to take all that time and sit down with the patients and
I think it's a very good question, and that's why not everyone can be a transplant hepatologist, unless if you are very busy in your clinic, you can't have time to do the counseling. Coming to the donation, I think it's very important that obviously we need to stratify the risk to the donor. It's by trying to help a sick patient, you don't want to put at risk a donor.
Yeah.
Therefore, this is a very complex
It's a balancing
process.
act.
And it's a voluntary donation. We can start from the school education. I think that's where we need to start and educate about the organs. And if you donate, which organs you can donate. And then if in the living donor area. For the cadaveric, I think we need to promote the idea of donation after death.
Yes,
You know?
exactly.
And I think that's what we are talking about, the donor
Yes.
donation. And I think in Pakistan, there is a need to work, like there's a huge need to work from all stakeholders.
Exactly.
Government, we need to improve intensive care because most of these cadaver will be found in intensive care. And then to improve the care of the potential donor as a cadaver. And then we need a lot of knowledge about brain death and, you know, there's a lot of things.
There's so many complexities because it's
Exactly.
not just a scientific phenomenon. It's lots
it's
of
not
emotions
straightforward.
involved as well, which
Yeah,
makes it harder to
exactly.
sort of.
I think it's a very challenging
very
thing.
challenging.
And
Absolutely.
what we normally do in our way, the way we work, we provide full information with the benefits and risks. Like in liver for donation, there is like a 1 in 300 chance of death to the donor. That is like a very small risk, but there is a
but
risk.
that again, the informed decision that you were
Exactly.
talking about,
That's
you give them all the
important,
facts, and then they are
Yeah.
told how to make that decision.
Yeah.
Okay, tell us how supportive the government has been with your programs.
I think I must say that normally people criticize governments, and I'm also one of those. But I think when it comes to liver transplant, I must say the government of Pakistan has done a lot to try and establish a sustained and successful public sector liver transplant program. And my research tells me that they have spent about 25 billion rupees since 2003 to try and set up a public sector transplant program, starting from SIUT, Sheikh Zayed Hospital, Pakistan Institute of Medical Sciences, Islamabad, MH Rawalpindi, and more recently, like Pakistan Kidney Liver Institute. But if you look at from 2003 till date, I think these public sector transplant programs have only performed less than 150 transplants. Compare that with one private sector program, and that is in Shifa, that they've done 600 transplants. And I can tell you that about 35% of the transplants at Shifa are sponsored transplants.
Okay.
And the greatest, more than 50% of those transplants are sponsored by the government of Pakistan, actually.
Okay.
So government of Pakistan is doing a lot to try and like set up and improve the skills and to promote organ transplantation and develop transplant programs.
Right.
And I've been working with the PIMS program to try and revive it. And I can tell you that there is a summary still lying with the PM House for approval, where the private sector is offering them to try and help.
Okay.
And whatever we have learned to develop programs in the public sector as well, because we have already shown and there is a track record. But I think they have to agree to different models because it's a very expensive service. Team building.
What are we talking about in terms of somebody who's going to have a private liver transplant? Around about how much are the costs? And
the pre-transplant evaluation, that process takes about $500,000,
okay.
330 to about 500, depending how sick the patient is,
Okay.
if they need optimization.
Right.
And then on the day of surgery, it's about 4.5 million they have to deposit. So it's about $500,000 rupees per
Right.
transplant in
Quite
private sector.
5
That's
million.
true.
5 million,
Right,
sorry.
okay.
Yeah.
So just before we go, some tips on how to look after your liver, diet, lifestyle, anything?
I think how to look after your liver is as important or as same as how you look after the rest of the body. Your diet, your exercise, the places you get your medical checkups from.
Very
you have
important
to
point.
see what injections that you have to go to a place where you know that the injections are safe.
Okay.
And so you have to take care of all of that. And that's how you take care of yourself. The liver is part of you, and it's like the rest of the body. You have to take care of it. You have to get regular checkups as well from good places, not just from quacks.
Absolutely. And Dr. Najim?
I think awareness about the liver disease, reading about it, and then if you have symptoms, to seek medical advice as soon as possible.
To be essential.
And I think there are preventable diseases like metabolic diseases, for example, before they affect your liver. If you find them out, then you can do some preventive treatment and stop prevention. The one I said, the natural progression, at each and every stage there is an effective treatment to stop further progression of the liver disease. So I think I would say that awareness is very important.
That's key as well.
That's the key, yeah.
Okay. Thank you very much, Dr. Najim and Dr. Ehsan, for being with us here today. Well, we come to the end of our program, and it really has been one where our experts have been able to give us lots and lots of information. As they have said, and as is common sense, if you are going to respect your body and look after your health, of course, you are the one who's going to gain, and prevention is always better than cure. See you next week. Stay happy, stay healthy. Bye-bye.